when you get diagnosed by something as scary as what is called a pituitary tumor. It's pretty scary. My name is Abhishek, and I recently underwent a transsphenoidal pituitary cyst removal. How it got diagnosed is a couple of months back. I was having a lot of headache. My hormone levels were dropping. So we did a MRI scan, and of course it was immediately clear that there is something wrong there. And then this is where the tough question was, okay, how and where should I probably get operated upon? It's not an easy decision, especially because, when you get diagnosed by something as scary as what is called a pituitary tumor, it's pretty scary. So we needed to be sure that we find the right healthcare provider, the right surgeon who can understand my condition, who knows how what's the best process for me. We were referred by some friends and colleagues to come to King's Hospital because they have a great neurosurgery department. We came here, we met Dr. Anila. She went through the MRI scan and she was amazing because she explained to us exactly what has gone wrong, what's her approach towards the surgery. She comforted us, she listened to us. We shot at her thousands of questions because, of course, it was completely new, it came out of the blue. My wife, the family, everyone was scared about this process, what the surgery would be like. She even explained to us through the MRI images her approach towards the surgery, what are the risk factors, which was very comforting to us. And she explained to us how she will try to steer away from those approaches which can create any risks. We also understood the technology that the King's Hospital uses, which has a GPS system, and it was amazing.
Abhishek was referred to me by our endocrinologist at the King's College Hospital. He was seen by them because he was having some hormonal issues. Few of the hormones in the bodies were decreased, and as a result of which they did an MRI of the brain. And the MRI of the brain showed a very large cyst in the pituitary gland area, which was also compressing the pituitary gland, and as a result of which there was hormonal deficiency. Along with that, the cyst was also compressing his optic nerves or the eye nerves. And he came to me in my clinic. At that time, he did not had any eye symptoms. We spoke about what is the problem. It was a benign cyst, but unfortunately located in a wrong area and compressing two very, very important structures of the brain, which is the pituitary gland and the optic nerve. And then, lo and behold, few days later, Abhishek received a call from him saying that now he has started to develop the eye symptoms and he was having a defect in his visual fields. And at that time, they came back to my clinic again. We decided to do the surgery. The surgery is usually performed through the nose. We call it an endoscopic transsphenoidal surgery, which means we actually put a small camera scope through the nose. We reach at the base of the skull where the pituitary gland is situated. We identify it by the GPS or neuro-navigation of the brain, and then we drain the cyst. We spoke about all the risks and benefits of the surgery, and I'm glad that Abhishek trusted me, believed in me, and went through the surgery. The surgery went very smoothly. We were able to take out that cyst. Dr. Roberto was there with me to help me guide through the nose. And once the surgery was done, immediately post-surgery, Abhishek told me that his vision is improved.
Post-op, it was brilliant. I hardly felt a thing. Although, of course, everyone was saying the surgery went smooth, I didn't feel a thing. So I actually had to question whether I did undergo the surgery or not. It was that amazing. So hats off to the doctor, Anila, hats off to Dr. Roberto as well. It was beautifully done. There was no pain whatsoever.